decades, the solution to housing the homeless was placing qualified individuals into 2 year transitional housing facilities with programs to help them become stable residents. This happened from when the transitional facilities were first established in the 1980s up until um, sometime around 2011 or so. This approach was proven to be ineffective for several reasons. Agencies placed qualifications on entry to serve the least vulnerable individuals. This kept the most vulnerable individuals with mental health and substance abuse issues on the streets and in the woods. 2 year transitional housing programs provided case management that is agency based rather than client directed. Agencies were more interested in keeping beds filled to receive funding than in helping people transition out of services. Transitional housing doesn't change an individual's status as homeless but provides shelter for the less vulnerable. When the 2 years expire, the homeless individuals either remain in the facility, beds equal funds, or return back to the streets or woods. I am a strong proponent of housing first, but agree that there are times when a short term 30-day emergency shelter is needed. In my own experience, I left a violent domestic situation when my ex, during one of her psychotic episodes, actually broke my nose. Not the cartilage, the bone behind the nose. I went to a short term shelter at a Salvation Army. I stayed there for a week until my paycheck arrived, and with those funds, I moved away from the area to escape the continued abuse. Speaking of abuse, domestic violence shelters and traditional domestic violence homes are very important. These individuals may not have the resources or self esteem to move into their own place right away. Victim advocacy and domestic violence provide support that they couldn't get otherwise, including security, legal, medical, counseling, and most obviously the protection from the abuser. Youth shelters for runaway and abused children is another needed transitional facility. Children in transition need a safe place to go. Children and youth shelters provide case management services, health care, and access to education that these children would not otherwise be able to have on the streets or in the woods or even in someone else's home. Hospital transitional facilities are helpful for patients in recovery who can't remain in the hospital but are not healthy enough to return back to the street or the woods. These programs provide shelter, security, and most important, well checks to make sure they're still um, healthy and safe. Reentry transitional facilities provide shelter and programs for people reentering the community from prisons or jails. These programs connect individuals to employment, health care, and the other community resources that help keep them from returning to incarceration. When we introduced the Housing First model in Brevard County, Florida, we entered into an agreement with the Housing Authority to give priority to our most vulnerable clients. And we used a vulnerability index and the coordinated housing assessment team to manage the voucher process. The Emergency Housing Voucher Program provides housing choice vouchers to local public housing authorities to assist individuals and families who are homeless, at risk of homelessness, fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or human trafficking, and were recently homeless or have a high risk of housing instability. The Continuum of Care is a local planning body that coordinates housing and services funding for homeless individuals and family. The COC program is designed to promote community-wide commitment to the goal of ending homelessness, provide funding for efforts by nonprofit providers and state and local governments to quickly rehouse homeless individuals and families and minimize the trauma and dislocation that homelessness causes for individuals, families, and communities, promote access to and effect utilization of mainstream programs by homeless individuals and families, and optimize self-sufficiency among individuals and families experiencing homelessness. Provisions in the Continuum of Care program interim rule require that COCs establish a coordinated entry system. This coordinated entry system helps coordinate and manage crisis response resources so that the CE system users can make consistent decisions based on available information to connect people to housing and service interventions efficiently and effectively. Specific requirements for CE systems include non-discrimination and affirmative marketing requirements. CE systems use standardized assessment tools, prioritization policies, and practices to consider the unique needs of different populations, including families, youth, survivors of domestic violence, and populations that are disproportionately represented among people experiencing homelessness. The most intensive interventions should be prioritized for those with the highest needs as identified by the community. There are four core elements of a community CE system designed to aid households and who require assistance through the housing crisis response system, including one, establish access points for people experiencing a housing crisis. In Brevard County, we used 211. Institute an assessment process to gather information on people's needs, preferences, and the barriers they face to housing instability. We created the Coordinated Housing Assessment Team, otherwise called CHAT. Once the assessment has identified the most vulnerable households with the highest needs, the COC follows established policies and procedures to prioritize households. We use the Service Prioritization Decision Assistance Tool, otherwise called SPDAT, and then refer households to the most appropriate intervention, whether it be diversion, maybe moving them to family members elsewhere, shelter in place where they are staying in the woods or in the streets, transitional housing in those specific cases where that is the best use. Rapid rehousing, which is basically providing rental assistance to help people stay in an apartment for a specific set amount of time. Permanent supportive housing, that's permanent housing with case management services, and then permanent housing on its own. COCs and victim service providers are responsible for determining the eligibility for the emergency housing vouchers, referring eligible families to the Public Housing Authority, and providing documentation to the Public Housing Authority that the family meets the eligibility criteria. As an example, can be provided to the Public Housing Authority is a sample certification of homelessness and sample certification of human trafficking. In addition, a sample certification for survivors of domestic abuse, dating violence, sexual assault, stalking, and or human trafficking is available on the HUD website. It's also an example of acceptable documentation once the Public Housing Authority receives that from the COC or victim service provider that the family falls into one of those categories. No further documentation is needed from any of those sources. For emergency housing, I should say, in the process of homelessness, getting people off the streets, there are times, really important times, for those emergency housing situations, but keep that a short time, like 30 days or so, to get them off the streets into emergency housing and then into the rest of the program through the Coordinated Housing Assessment Team. Thank you.